Hello, I'm Dr. Omar Danner, and today I want to talk to you about what's called gut permeability syndrome or spectrum of disorders. Some people in the lay community may refer to it as the leaky gut syndrome. This entails, conditions such as dyspepsia, a gastroesophageal reflux disease, or gastritis, or some people may refer to it as GERD or indigestion. It also includes conditions such as celiac sprue or celiac disease, irritable bowel syndrome, inflammatory bowel disease, as well as different forms of like colitis or colon inflammation, and dysbiosis, which is abnormal bacterial overgrowth syndrome. When you have your bacteria in your gut, the normal commensurate bacteria are overwhelmed by more pathogenic bacteria, causing all kind of gut inflammation and gut irritations, which may include diarrhea. It may include constipations and alterations between the two, including abdominal pain. But what causes this gut permeability syndrome? It's actually a lot of times the foods that we eat. So when you think about it, if you put something in your body that the body does not tolerate, then the body's going to react in a way to try to fend off that substance. If it were a virus or bacteria, we'd call those antibodies or phagocytic cells. But when it's food, there's actually an antibody in the gut lining called IgA. Immunoglobulin A binds to these food particle antigens and leads to the release of a protein called zonulin, Z-O-N-U-L-I-N, which when it opens up, is called a pore, opening in the junction between the cells of the small intestine. It allows these antigens, which are broken down, to enter into the bloodstream and bind to another antibody called IgG, or immunoglobulin G, which is the most predominant antibody in the bloodstream. But in the gut, there's a second phenomenon, and it blocks the absorption of different micronutrients in a non-selective manner, and this leads to nutritional imbalances. So what causes the dysfunction associated with the gut permeability syndrome is actually the inflammation combined with micronutrient elimination, and this is what's causing your GI disturbances and your disease manifestation. I hope you found this helpful. This is Dr. Omar Danner. Thank you for joining us. Have a nice day.